Hi, everyone. I'm Amy Zellmer, and I am here today with Dr. Jeremy Schmoe. Say hi, Jeremy.
Hi.
Jeremy has been my doctor since about August, September. So the last couple months we've been working together. And I'm going to introduce Jeremy here for you guys. Dr. Jeremy Schmoe is a chiropractic neurological rehab specialist. He is a lecturer and owner of MFNC Brain Rehabilitation, which is located in Minneapolis, Minnesota. He works with patients from all over the Midwest and across the country. He is an advocate for traumatic brain injury awareness, and he started the Minnesota Concussion TBI support group for his patients. And his website is mnfunctionalneurology.com. And so Jeremy is a functional neurologist. He actually found me. He found me through my Huffington Post, one of my Huffington Post pieces, and he saw that I was local, and he reached out to me and was like, I know I can help you. And I kind of blew him off because I was like, yeah, nobody's been able to help me. So finally I was like, oh, what do I have to lose? So I went in, and he, in the last few months, has done more for me than any doctor has done for me in the past 2.5 years. And so today I want to share with you 5 ways that functional neurology has helped me get a quality of life back. So I'm going to talk about 5 key areas that he has really helped me. And the first one is with dizzy and balance. And this is something that I hear from like so many people who've gone through a brain injury or concussion. They're just constantly like dizzy and off balance, and nobody can pinpoint what's causing it. And it sucks the life out of you when you are living with 24/7 balance and dizziness. It's extremely exhausting on top of the exhaustion you get from a brain injury. And so Jeremy, I had been telling everybody, it's my eyes. Something's not okay with my eyes. And everybody was like, no, your eyes are fine. Your eyes are fine. And Jeremy took one look at me and was like, yeah, your eyes aren't tracking together. And so he has helped me with some simple exercises with my eyes. And he incorporates like body movements in with my exercises. And within 2 weeks, he had my dizziness really under control. And if something kind of triggers it again, I can just sit down and do my exercises and kind of help settle it down. So Jeremy, I'll have you kind of talk about how you figured out my eye problems and what it is that we do to work through it.
Yeah, so it all kind of starts off with us doing a really in-depth history to start, but then also doing a really good bedside neurological exam. And one of the things that I saw with you is when I assessed your VOR, your vestibular ocular reflexes, when we would move your head, left and right, things looked good. When we would move your head up and down, things looked good. But it was when we would roll your head that there was a change in how your eyes would actually rotate back in the opposite direction. So commonly when we see issues like that, where there's some sort of like torsional issue going on with the eyes, people feel like they might be rocking and rolling on a boat. Mm-hmm. And that's kind of what you had going on. Yeah. And we were able to come up with some really simple head and eye movements to basically get those eyes to roll the way that they needed to. So when you would move your head, your eyes would move equal and opposite. So it was actually pretty simple. We just did it by looking at the bedside. And then on top of it, we also run VNG testing. So we look at, hey, can you keep your eyes steady? Can you follow targets? Can you move your eyes quickly? And can you tolerate motion? And one of the things that we saw with you is you had a really hard time with your vertical, what's called an optokinetic reflex. So when you would move your head and when things were moving rapidly in front of you, it would make you feel dizzy. So we just came up with some exercises to improve those optokinetics, and within a couple of weeks, you started to see that your brain knew where you are in space again, and you started to feel better.
Yeah, and one of my big complaints was when I would lay down at night, I would close my eyes, and as I started to drift off to sleep, it felt like my eyeballs were rolling around in my head, and that made me just kind of like feel dizzy. And so one of the exercises he had me do was, as I was laying there with my eyes closed, I pretended I was looking at something off in the distance. And that really, really, in the beginning, it was so hard to do it. Like, it actually hurt to try and do it. And now I do it every night when I go to sleep. It's such a simple exercise, and it helps.
Yeah. We do visualization exercises all the time with people. So we'll see people that are extremely light sensitive. They can't even tolerate doing eye exercise. We know that we can use the circuitry by having you just visualize keeping your eyes steady on a target. We can still get into those pathways to try and stabilize them and make them work better. And one of the things that people, don't really realize is that there's a huge integration between your cervical spine and your eyes. So if you have issues where you have a chronic, whiplash associated disorder, and you have headaches and you have neck pain and you have dizziness, we need to work with both. So we need to work with the cervical spine, but also work with the eye tracking and the vestibular system. And when you get those pathways and you get them integrating better together, your brain's going to know where you are, and you'll see things like neck pain improve without, doing tons of muscle work and, a lot of adjusting. It's just kind of integrating, getting those systems work together.
So that brings me to number 2, and I'm going to change it on you, Jeremy. Headaches. I was having headaches. I mean, out of 7 days of the week, I probably had a headache 4 of those days, 4 or 5. I just constantly had chronic headaches. Some of them would just completely take me out for the day. And other times they were like, I could work through them, but it just sucked. And so that kind of ties in with what you were just talking about. And my neck, I had so much pain from my whiplash and my C4-5 problems. And it was like, I remember when we first started working, you didn't even adjust me for months. You did your ARP treatment on my neck and Prologel. And I didn't have a headache for weeks. And it was like, what's going on? It was so amazing. And then now we've had really crappy weather. And when that barometer goes down, I get a headache. But they're better. They're not at the threshold of 10 that they were last winter or the winter before. So they're improving.
Yeah. So, my idea was, well, if we need to get your balance better, because if you remember, you would close your eyes and you would fall basically straight backwards. Mm-hmm. So if your balance is not where it needs to be, all the little muscles in your neck are going to be doing way too much work. And when they're doing too much work, then that leads to sensitization of different peripheral sensory nerves, and then that refers pain up into your head. So we were able to get your balance more steady by getting your eyes to do what they needed to do, and then go in there and start doing some exercises to activate your, what we call central spinal axis, or your core. And then when you would go to move your head and neck around, it wouldn't put so much force into your neck. And then you started to see improvements in your headaches. And one thing not to forget too is that we also upped your magnesium. Yeah. And we worked on getting your magnesium status where it needed to be. It was low. And that's just a really simple way to basically help improve stability in neurons, is by using magnesium. So it was the combination of getting the eyes steady, getting your balance steady, getting the neck and the muscles to do what they needed to do, and then doing some metabolic work to decrease some inflammation and get some better neuron stability. Mm-hmm.
And then the third thing I have on my list is my reaction times, my visually, auditory, physically. I remember when we first started working together, you had tennis balls, and you threw from your hand to my opposite hand, and then back and forth. Yeah. It was I couldn't catch them, and it was frustrating. And then you have the interactive metronome, where I'm listening and clapping my hands to the beat with this thing that measures it on my hand. And I felt like a broke, the Energizer, that monkey. I felt like a broken one. It was wait, And I used to play Rock Band on the PlayStation, and I used to be so good at it. And it was like, oh my God, I can't even like hold a beat. And that kind of like clicked in my head as to like, I hadn't sang along in the car since my brain injury. And I thought it was more of an energy thing. Like maybe I didn't have the energy to multitask and drive and sing. No, I think it had to do with not being able to like keep timing with song. And then you also have the D2 machine, which is all these little circles of light, and you, as it lights up, you're supposed to touch it and move. And
you're really slow.
It was really slow, and I really discovered I had a sort of a blind spot almost over here. Which I still notice it, but I feel like it's definitely better.
Yes, I mean with the Dynavision
my
D2,
reactions weren't good.
With the D2, it measures all your kind of peripheral visual fields, and we can figure out, are you slow in the upper quadrant or the lower quadrant, and then we can kind of correlate that to like what we see with your bedside neurological exam. And one of the things that I remember is you had some change on your sensory feedback from the left side of your body. But then when we put you up on the D2, you were slow with your reaction times over to the left. So those are some things that we worked on. And we noticed that your quick eye movements or your saccades were also kind of slow. So what happens with the brain is you build maps of where you perceive your body to be in space based off of these quick eye movements. So your quick eye movements were slow and the latencies were elongated. So we did things to get your eyes to move quicker, more accurate, and then that built a better idea about where you were in space. And then that helped with your reaction times, your depth perception. And you have to remember, like, your gait was off at the beginning too. Just doing a normal opposite arm, opposite leg, like cross chord pattern, and that was off. And when we would have you, dual task and say every other month and walk, I mean, your gait significantly slowed down. So those are some of the things that we test with all of our traumatic brain injury patients. And then we recognize that. We give exercises to help improve and get that circuitry to fire better and get your auditory system, your visual system, the vestibular, and all your muscles to all kind of integrate better in your nervous system. And it's usually not that those pathways are broken, it's that they're not integrating together.
Right. And so number 4 on our list was my autonomic nervous system. And you checked my heart rate and my blood pressure sitting and then standing and lying down, where, most doctors only check it when you're sitting in the chair, right? They don't bother to check anything else. And we found that my heart rate was elevated when I would lay down, which explained why when I went to bed at night, I like felt this like nervousness. And I had, I guess some of it too was maybe like startle syndrome. And because when I fell, I fell backwards and landed on my head. And I wasn't even able to sleep on my back, which I thought that was like PTSD related, but maybe it was more autonomic related.
So, I mean, my idea is that, when we did your examination, we looked at some of your cerebellar testing. The cerebellum testing, we'll look at finger to nose, we'll look at, rapid alternating movements, and you were off on your left side. And then you also feel like you're moving, and your gait was off. So I think that some of the circuitry in your cerebellum, which integrates all those things, was definitely off. And when you would lay down, there was a change in the gravitational input into your muscles and into your cerebellum, where your cerebellum wasn't gating your autonomic nervous system. And then you would go into sympathetic mode. So when you would actually lie down, your heart rate would increase, and then you would feel like you were starting to tack out, which is a little bit opposite of what I commonly see in my patients, where we'll actually put them on a tilt table and we'll raise them up 5 degrees and up 5 degrees, and you'll see that their heart rate will significantly increase as they go up, and then their blood pressure will go down. So for you, it's kind of the opposite.
Right.
And we did a whole bunch of therapy, which we'll talk about, but getting into the tilt table and working with you at different angles and doing different sensory stim to try and get your autonomics to be more stable and get your startle reflex to calm down and hopefully help your cerebellum work better.
Mm-hmm. And then in the beginning, and even just the other night, sometimes when I do lay down at night, I can still feel that like the heart rate. I can feel it kick in, and so I prop some pillows up and lay down, and that quickly it helps bring that heart rate back down, and I'm able to fall asleep. So.
Yeah, and we also ruled out, like, you don't have positional vertigo. So we put your head in different positions, and we were looking to see if these crystals in your otolith made it into different areas where they're not supposed to be, and if that was leading to some of your symptoms, but that wasn't. So we checked all your canals, ruled that out, and in my mind, it had to be the integration of how the cerebellum regulates your autonomic system.
Right. And then the fifth thing I have on my list is my anxiety and PTSD. My anxiety, about a year after my accident, when winter came again the next year, I had horrible anxiety kick in, and I had a terrible fear of falling on the ice. I have a fear of falling like on any sort of an incline. And I had been working with a therapist, and he's like, yeah, this is pretty classic PTSD. And the first time Jeremy got me on the tilt table, and he got me into my body knew the position. It was like all of a sudden he got me in that position, and I was like I knew I wasn't going to fall. I knew I was totally safe on this table, but it just triggered. And I mean, I remember the very first time I just started crying, and you took me out of it, but then you brought me back into it. And then you did some electric stimulation work on the left side of my body. And I remember like you maybe drew numbers on my foot or something and to engage the other side of my brain. And
so, I mean, a lot of therapists will do things like this. I mean, look at fields like EMDR therapy. They'll try to change your brain and your physiology as they have you talking about the events that happen to you, and they'll give you eye movements. And what we did was just work you through those different angles, but then give you neurological stimulation to try and get your nervous system to realize that, hey, it's okay to be into that position, and just try to change your neurology when you're in that position. So in my mind, we're doing sensory stim, but we're trying to reintegrate all the circuits that can be involved with anxiety. And it's really common for patients that have dizziness and vertigo to also have anxiety disorders, because it's provoking to not know where you are, to not know where you're going to place a foot, and not know if you're going to fall. So not knowing where you are in space can be very anxiety provoking.
And then how would you explain what startle syndrome is? I know I had a lot of that type, like I jump real easily, especially if somebody like you would come around me from the left side. It would just kind of cause like the startle. Really loud noises would sometimes cause it. I know I hear this from other people, but they don't know what it is.
Yeah, so when people injure their brain, so you have your brain, you have a skull, and it's sitting on your neck, and there's always a twisting and a torsion that happens when you injure your head. And just due to the biomechanics, different areas in the midline area of the brain seem to get affected. So those could be limbic regions, it could be the upper brainstem, and that's kind of where the startle reflex comes from, this Moro response. And the upper brainstem is not being gated, and it's firing too much. And it's kind of a final common area for light and sound. So if that pathway is unstable, lights can cause you to have a startle response, or sound can cause you to have a startle response. So there's actually a neurological reason why people are having those things, because there's changes in the circuitry. And on top of it, there's a lot of inflammatory receptors in that area of the brain too. So with brain injury, issues with the circuitry can happen, but there's also issues that are going on at the cellular level. So there's inflammatory responses and inflammation in the brain. And then another thing that we talked about is we ran labs on you, and we looked at your nutrition, and we looked at, do we have issues with your gut, issues with vitamin D? We look at everything that we can do to improve your neuronal health, everything that we can do to improve your neurology and your circuitry, and everything that we can do to improve your structure, and bind those things together. And when you look at those things, and you also integrate other types of providers like neurooptometrists and psychologists, and you get everybody working together, that is when you get the best care for that patient. And that's what we're good at doing in functional neurology.
Yeah. And you know, like I said, just within a few weeks of working with you, I felt better than I have felt in years. And you know, once you get that dizzy imbalance under control, that frees up so much more energy for your brain to do other things. And so I'm noticing my cognitive processing is improving. My memory is improving. You know, like today I spent the whole day at the Capitol lobbying. And so I'm kind of wiped out right now. But a year ago, if I'd have done what I did today, I'd be, I won't even be on this call right now. So like I can feel major gains.
That's great. And I'm just so happy. I'm so happy that you're feeling better, because, you know, I just feel like you're on a mission to go out there and spread the word about what we're doing and getting this information to everybody with TBI, and know that there's qualified people out there that, you know, want to work with your current practitioners that you're seeing, just to help push things along. And, you know, let's work together and collaborate. And I think 2017 is the year.
And so, Jeremy, how would someone find a functional neurologist? I'm going to post some links below the YouTube video for you guys to click on, but maybe just give a real, because there's not a ton of you. Limited species.
I think, you know, honestly, I think the best way to do it is to go onto Google and just Google functional neurology in your city. And then, you know, see what comes up. Check and see if those people have experience with traumatic brain injury. Try and go in, see if they have something like a consultation, and just kind of ask them what their training is. And usually that seems to work pretty well for people.
Mm-hmm. And obviously, if they're anywhere near the Twin Cities, I strongly encourage them to give you a call. And give us your website again.
So it's mnfunctionalneurology.com. And I also have another website. It's just mnconcussion.com. And on both of my websites, I have an ebook. It's about 18 pages, and it goes through how to find a best practitioner in your city. So if you just kind of follow the steps on there, you'll be able to find somebody, hopefully locally, that can really help you.
And now, Jeremy, what if somebody is, I mean, I was 2.5 years out from my injury. What if somebody is like 5, 10, 12 years and they still haven't found relief? You know, do you think you can still help them?
You know, I always like to think that we can, but the reality of it is sometimes there is permanency to brain injuries. And that's what we're trying to figure out. So we're trying to figure out, you know, what's working well, what isn't working well, what might be broken, and then try and come up with a plan that makes sense and set expectations of, you know, what are we able to achieve here, and kind of go from there. And the reality of care is that you can either make changes with people and get people better. All right. You cannot make changes with people, and we're going to be able to let you know if we're not able to make changes. All right. So that's kind of what we see with functional neurology. Is a lot of us are very straightforward. We're either going to be able to help you or we're not going to be able to help you. And we think in a short period of time, we should be able to make some changes objectively to your testing and to your symptoms. And if we can do that, then we're probably going to be able to help you.
Mm-hmm. Yeah. And I mean, I remember you telling me very early, I think it was maybe the first or second day, like, I don't think anything is permanently broken. I think we can get you better. And that was just like, yes, you know, because you start to think you're very, very broken.
Yeah.
Nobody has been able to help you. And so it was incredibly validating to have you say, yeah, it is your eyes. Because that's what I've been saying for 2.5 years. My eyes aren't okay. My eyes aren't okay. No, your eyes are fine.
Totally.
So thank you for being here today, Jeremy, and just sharing with all of my followers what functional neurology is. And it's helped me so much. I have seen so many changes just in the few short months I've worked with Jeremy. So thank you for being here, Jeremy.
Yep, thank you.